Hello, and welcome to CJJ's webinar on LGBT and gender-nonconforming youth in juvenile justice. My name is Jonathan Litt, and I'm the Policy and Field Relations Associate at CJJ. Before we begin, I'd like to take a moment to run through a few technical details. You will notice that all participants are and will remain in listen-only mode. That is, participants will be muted throughout the webinar. Presenters will take questions at the end of the presentation. You can ask a question in one of two ways. First, you can type in your question into the questions box at any time throughout the presentation. Second, during question and answers, you can click the raise your hand button. I will then call on you, unmute you, and you may ask your question verbally. I ask that if you are on a cell phone that you use the questions box, as that will avoid any audio feedback. We will be recording this webinar, and the recording, PowerPoint, and additional resources will be posted on CJJ's website within 24 hours. Next, I'd like to introduce our panelists for today's webinar. Dr. Angela Irvine is the Director of Impact Justice. She has more than 20 years of experience in education and social policy. Raised in Santa Cruz County, California, Angela earned her BA from UC Berkeley in 1984, her secondary teaching credential from St. Mary's College of California in 1985, and her PhD in sociology from Northwestern University in 2002, while simultaneously serving as a National Science Fellow in Public Policy and Program Evaluation. Angela spent 10 years running her own program evaluation and policy research business, and she has studied housing, education, health, and criminal justice policy. Angela spent the last 4 years as the research director at the National Council on Crime and Delinquency, serving as the principal investigator of a national study of juvenile de-incarceration, a national study of LGBT youth in the juvenile justice system, a project to improve permanency for LGBT youth and youth of color within the juvenile justice and criminal justice systems, a survey of every detention hall, ranch, and camp in California to understand statewide pathways into the juvenile justice system for LGBT youth, and the National Institute of Justice Research Practitioner Partnership Grant in Santa Cruz County to determine whether structured decision-making instruments used by adult probation departments can lead to more equitable probation outcomes for Latinos and women. Christina Gilbert is the director of the Equity Project, a collaborative initiative of the National Juvenile Defender Center, Legal Services for Children, and the National Center for Lesbian Rights. The Equity Project works to enhance policies and practices related to sexual orientation, gender identity, and gender expression, and ensure fair, equitable, and dignified treatment of LGBT youth in delinquency courts. She holds a JD from the Northeastern University School of Law and a BA in Social Thought and Political Economy from the University of Massachusetts Amherst. I'd like to turn it over to Dr. Irvine now.
Thanks, everybody, for joining us today. I really appreciate your interest in this topic. My colleague Christina Gilbert and I are going to cover 4 main topics today. We're going to go over the research on LGBT youth. We have a longer acronym, LGBTQGNCT youth, explain a little bit why they're overrepresented in the juvenile justice system. We're going to have a section on policy and how policy can help solve overrepresentation. We're going to cover data collection and how that relates to the Prison Rape Elimination Act. And then we're going to talk a little bit about training and technical assistance. You can move to the next slide. So before I start, I want to talk a little bit about terminology. And you know, I think that people probably hear different acronyms in different contexts, and for the purpose of this presentation, largely we're going to be looking at lesbian, gay, bisexual, and questioning youth, LGBTQ, and that's a grouping of terms that are tied to our sexual orientation or who we're attracted to. And we're also going to be looking at gender nonconforming and transgender youth, and that's a grouping of terms that is linked to our gender identity and gender expression, which is separate. Our gender identity is who we think of ourselves as being masculine or feminine, male or female, and our gender expression is how we express our identity. In addition, we will be using the term SOGI, which also, which is an acronym that stands for sexual orientation, gender identity, and gender expression. And the reason we use this term a lot of times is because everybody has a sexual orientation, a gender identity, and a gender expression. Again, we are all attracted or even not attracted, even if somebody's asexual, that is their sexual orientation. We all have a gender identity somewhere on the spectrum between male and female, and we all express ourselves somewhere on the spectrum of masculine to feminine. Next slide. This slide explains what I've just been talking about in a more visual way. So again, there are sort of 4 aspects of sexual orientation, gender identity, and gender expression. We all are assigned a sex at birth, generally male, female, or if you are intersex, you're I don't think we identify anybody as intersex on birth certificates, but you can be born intersex. Gender identity is non-binary, and we all fall on the spectrum between man and woman. Gender expression, somewhere between masculine and feminine, and then our sexual orientation is distinct, and it's who we're attracted to, somewhere between attracted to only women to attracted only to men. And again, a lot of people fall in between. So next slide. So in terms of research, why are lesbian, gay, bisexual, questioning, gender nonconforming, and transgender youth overrepresented in the juvenile justice system? We have a little quiz for everybody. So next slide, please. So is this true or false? And everybody has a chance to vote on this. Few, if any, youth in the juvenile detention facilities across the country are LGBT, or lesbian, gay, bisexual, or transgender. So select one of the following, true or false. Okay, so great. So the results, 9% of people said true and 91% of people said false. And false is the right answer. If you want to move to the next slide, we can talk about that. According to the federal and national survey data, as well as the California state data that we've just collected and analyzed, 20% of youth in juvenile detention facilities are LGBT, and that's compared to about 5 to 7% of the general population. So that means we have about, a 4 to 3 times, rate of overrepresentation for LGBT youth. Now, if you think separately about boys versus girls, that rate is different. And so about 12% of boys are LGBTQ GNCT, to use that longer acronym, and 40 to 50% of girls disclose being lesbian, bisexual, or gender nonconforming. And that has huge implications for other policy areas that I'll talk about in a little bit. You can move to the next slide. So we have another quiz question. And this is a multiple choice question. Compared with straight youth, LGBTQ GNCT youth are at least twice as likely to A, be removed from their home because someone was hurting them, B, run away, C, be homeless, D, all of the above. Great. So almost everybody was right. 97% of you were right. So the correct answer is D, all of the above. Research shows that LGBTQ GNCT youth are at least twice as likely, you can move to the next slide, are at least twice as likely to be removed from their home, to run away, and to be homeless. You can move to the next slide, which is the answer slide. And LGBTQ GNCT youth are also at least twice as likely to be detained for status offenses and for prostitution charges. And so this has obviously implications for anybody that's doing de-incarceration work in terms of moving low level offense youth out of the juvenile justice system. We should really be thinking about this LGBTQ GNCT population. And also, you know, there's this whole focus right now on commercially sexually exploited minors. And in the California data, about 3.5% of girls have been picked up for prostitution charges compared to 8% of lesbian, bisexual, and GNCT girls. And so I just bring this up because for anybody doing sort of specialized policy work, we should be thinking about this LGBTQ GNCT population. The other thing that I want to bring up is that among the LGBTQ GNCT population, 90% of LGBT youth, to use the shorter phrase, are of color. And so a lot of times we think about LGBT youth being mostly white, but in fact, there's this huge overlap between disproportionate minority contact or racial and ethnic disparities, the overrepresentation of LGBT youth, and then issues around girls and gender. Okay, next slide. This next slide really summarizes a lot of the risk factors for youth. So if you do a deeper dive into the research, there you see a pattern of family rejection for LGBT kids, a high rate of harassment in prior placements, harassment in schools, isolation, low self-esteem, and homophobia and the lack of understanding among the community. And so as a result, that's why you see high rates of homelessness, survival crimes, running away, patterns of running away, poor attendance in schools, substance abuse, and inappropriate charges. So you can move to the next slide. We have one more quiz question, which really focuses in on conditions of confinement. And so the question is, LGBT youth are sexually victimized how many times more often than straight youth? So are they 2 times as likely to be sexually victimized, 7 times more likely, or 12 times more likely? And this is by their peers as opposed to by adults. Ooh, the majority were also right. So we had 13% who said 2 times, 57% said 7 times, and 30% said 12 times. The correct answer is 7 times. If you move to the answer slide, we'll see a breakdown on this slide of the rates by other youth compared to adults. So if you look at that second bullet, the rates of abuse by staff are actually about the same for LGBT youth versus heterosexual youth. But where you see a great disparity is that 10.3% of LGBT youth reported victimization by another youth compared to 1.5% of heterosexual youth. And the next slide has a summary, again, of some of the issues around conditions of confinement. And so you see high rates of harassment, physical and sexual abuse within secure facilities, which unfortunately sometimes leads to segregation for those youth or isolation, which then increases the chance of suicide, suicidality, or isolation from program participation. We see a high rate of lack of understanding around transgender youth and youth being punished and pathologized and treated as dangerous. And we also see a lack of competent services and placements across the spectrum, so across sexual orientation, gender identity, and expression. and as a result, we end up with longer lengths of stay in both secure facilities, community supervision, and sometimes some services like out-of-home placement where there are indeterminate sentences. So next slide. I think we're moving on to policy. So I'm going to hand the baton to Christina now.
Thanks, Angela, and thank you everyone for being here. So I think it's really important to have that kind of data and understand a little bit of about the overrepresentation of LGBT youth in the juvenile justice system. And I'm going to use LGBT just because it's shorter and we don't have a lot of time. But you know, in the particular data, Angela talked a little bit about gender nonconforming youth and LGBTQ. But I'm just going to use LGBT just to simplify things. So it's important to have that and also understand a little bit about their experiences in order to kind of address these disparities. So I just wanted to touch briefly on, you know, the policy landscape and look at where all the places are that LGBT youth, or all youth, where do youth get rights from? And so when we look at the policy landscape, we can look to the Constitution, federal law, state law, local ordinances, facility or agency or system policies, as well as best practice standards. Next slide, please. So all youth have constitutional rights: the right to be free from physical, emotional, and sexual abuse, the right to be free from isolation, the right to receive adequate medical and mental health care, the right to be free from discrimination, and the right to freedom of speech and freedom of expression. Next slide, please. In addition to some of the fundamental constitutional rights, I'm not going to go into detail on these federal and state laws, but a couple of federal laws that it's important that many of you are probably aware of are the Juvenile Justice and Delinquency Prevention Act, which hopefully will be reauthorized soon. And even though the JJDPA doesn't say anything explicitly about LGBT youth, I think in particular, when we know that it protects all youth, there are a number of really important requirements in it. And in particular, there's a section on addressing disproportionate minority contact or reducing racial and ethnic disparities. And given the data that Angela just gave about the majority of LGBT youth in the system being youth of color, we can see how this has a really strong impact. Additionally, there is a requirement that status offenders are not detained, but a number of you are probably aware of the valid court order exception, which hopefully will be eliminated, which basically says that youth can be detained for status offenses if they violated a valid court order. And as we saw with the data earlier, LGBT youth are more likely to be detained for status offenses. So that would also have a huge impact. In addition to the JJDPA, I'm sure a lot of you on this call are familiar with PREA. So the Prison Rape Elimination Act is the federal law. The juvenile facility standards, which are actually the regulations, do include specific provisions around LGBT youth who may be vulnerable to sexual abuse because of their sexual orientation, gender identity. There are some requirements in those regulations about not isolating youth and around searches. We're not going to go into detail here about PREA. Angela will talk a little bit about data collection, and when I talk about training, I'll talk a little bit about it, but it's something that's really important to be aware of, in particular those provisions that do pertain to LGBT youth, and then also just looking at your various state laws and regulations. Next slide, please. So why do I have a slide in here about employment non-discrimination when we're talking about youth in the juvenile justice system? I thought this was important for two reasons. One is that we often do this work and we talk about the experiences of LGBT youth in the system without even mentioning adults working in the system who may identify as LGBT. And when we look at this, this is just one example. The Movement Advancement Project put these together, and they have similar maps of housing non-discrimination laws and public accommodations laws. And it's just important to kind of look at to get a sense of what the landscape of the country looks like, and also to consider the people who may be working in these very same juvenile justice systems when people are having these trainings, that it's not only necessarily about the youth in the system, but the people working in the system as well. Next slide, please. So these, I am not positive that this is all of them, but these are the states and localities that we are aware of that have comprehensive LGBT policies within their juvenile justice system. If you know of others, I would love to see them. We have these on our website along with model policies from Hidden Injustice, but these are the ones we know of that have comprehensive policies. Some of them are system-wide. For instance, Santa Clara County is a probation department-wide policy. The Orleans Parish policy in Louisiana is facility-specific. However, Louisiana does also have statewide juvenile detention standards, which do have some protections for LGBT youth. New York, there are citywide policies and statewide policies, and some of them go into detail about case management and processing and intake regarding LGBT youth, and some of them may be as simple as including non-discrimination within their non-discrimination policies, a ban on discriminating based on sexual orientation, gender identity, or gender expression, or they may have some combination of those. Next slide, please. So what do these policies look like? I encourage people to look at them if they want to see what various states and localities have done, because they're not all the same, but these are common provisions. I think the non-discrimination provisions are really important. That's one of the things I just stated, you know, adding to the clause about all the classes of protected status that you can't discriminate against. Screening and intake, often about asking questions. Angela will talk a little bit more about that. Classification and housing placement, where youth are housed and how those determinations are made, particularly often for transgender youth, confidentiality about youth SOGI, privacy and safety for transgender youth. These provisions often include things like the opportunity to shower alone, respectful communication, access to LGBT supports. That's often about having competent service providers, as well as LGBT inclusive materials, medical and mental health services and treatment, training and policy dissemination. That's about getting staff being trained on the LGBT policy, as well as how it's disseminated, how people get notice of that policy. And then youth education and policy dissemination. Some of these policies are really important too, to make sure that the people within the facility or within the system also know their rights. And then enforcement, how, you know, a policy is great and having something in writing is excellent, but if it's not enforced, then it's just a piece of paper. So how is this policy going to be enforced? Next slide, please. Oh, and so I think we're going to move back into, speaking of one of those provisions, just a little bit around data collection. I'll let Angela go into a bit more about this before we move on to training.
So great. So the reason that we're covering these three main areas as a way to address overrepresentation of LGBT youth. And the first that Christina just went through is policy. And we see that as a first step towards reform, because that sets up the professional expectations of everybody on staff at either a group facility or a secure facility, or with community supervision staff. The next step is really thinking about collecting data on sexual orientation and gender identity and expression from all youth, because from an operational perspective, that allows systems to identify points of disparity that can be addressed, much like we've addressed racial and ethnic disparities across the whole system. After I finish this section, Christina is going to talk about what is training and technical assistance, and that's really necessary to be able to come into systems and let all the line staff sort of know about new policies and how to collect data so that reforms can happen. But in terms of focusing on this topic, collecting SOGI data, as it turns out, under the Prison Rape Elimination Act, there were some standards that referred to data collection, though they were a little unclear. And so the BJA and the Pre-Resource Center released an FAQ that clarified the standards, and what is required is that all jurisdictions who want to comply with PREA are expected to collect data on sexual orientation, gender identity, and this is important, perceived gender expression that places people at risk of discrimination. Next slide. So we've been providing technical assistance to a number of jurisdictions around the country, and what we've found is that you can get most of the information you need by asking 5 to 6 questions. And so we have piloted questions for youth in the juvenile justice system down to the age of 12. We've also been running parallel projects in child welfare systems and have piloted questions for youth down to the age of 10 in those systems. But I'm about to share the questions that we have used in the juvenile justice system. You can move to the next slide. Now, these questions have been adopted by 12 different counties in the central region of California. I really want to shout out to the Chief Probation Officers of California have formed an LGBT youth work group that are, and they are partnering with my organization to conduct research on LGBT youth and also receive some technical assistance. And the central region of the Chief Probation Officers are really taking the lead. So they are the, sort of 12 most conservative counties in California, which some might find surprising that they're taking the lead on this, but they're just really committed to serving this population. And so those 12 counties collaboratively came up with these questions that we are encouraging other jurisdictions to adopt. And those questions are: what is your gender? What was your sex at birth? What is your gender expression? What is your sexual orientation? Who are you attracted to? And those are the questions that you ask of youth, and those are worded in a way that are, sort of a lower reading level than might be used otherwise. And then for staff, we're recommending that people keep a sort of data field where they collect information about, does the youth's gender expression match the cultural and societal expectations in the general community? And this really gets at what the FAQ is requiring of jurisdictions, to make some sort of note about whether or not the adult perceives the young person as being at risk of discrimination. Next slide. I think and so then once you have a protocol in place, you can train your staff to collect data. And then again, once you have the data, you can start to identify points of disparity in your system. In the Central Valley of California, we are going to be analyzing all of their SOGI data this summer, and then starting to create a continuum of services within the community to address the needs of those youth. So if anybody has any questions about that, please feel free to ask later. And I'll pass the baton back to Christina.
Thanks, Angela. So in addition to training, as Angela was talking about training on collecting data, we often get requests for training about, a lot of it is education and awareness raising about LGBT youth in the juvenile justice system, because in order to improve the outcomes, you have to know why LGBT youth are ending up in the system. Having more data will really help us a lot and move this forward, but we do already have a lot of knowledge around this, as well as what the experiences of LGBT youth within the system have been, and how to address those to reduce these disparities, as well as to establish the professional expectations for institutional and correction staff, but in addition to institutional staff for all juvenile justice stakeholders: judges, defenders, prosecutors, probation officers, social workers, medical and mental health care, anyone who works with youth in the juvenile justice system. And then follow-up technical assistance and coaching can support staff and stakeholders as they work on changing their practices and policies. Next slide, please. Oh, sorry, next slide. So to this end, the Equity Project, along with a number of, I should shout out to Angela, who is a member of the Equity Project Advisory Committee, and a number of our other excellent advisory committee members who do training, also works with the Equity Project to develop a comprehensive training curriculum specifically designed for juvenile justice professionals on working with LGBT youth. You know, for many years, the Equity Project heard a need from the field that there were other curricula out there about working with LGBT youth, but they weren't specific to those working in the juvenile justice system. So this was publicly released last week and is available on the Equity Project website, which is up there on the slide. You can go to the Training and Technical Assistance tab, and I really encourage everyone to take a look, because I'm going to go through some examples of what the training provides, but I can't do that in, you know, 15, 20 minutes. It's a really comprehensive curriculum. It's not a PowerPoint. It was designed with adult learning principles in mind. It's really interactive, provides participants with a lot of opportunities to participate in hypothetical scenarios and various activities. But it's also designed to be adaptable to a trainer or a jurisdiction's needs, recognizing the limited time available for trainings. Next slide, please. So the training has 6 different lessons, which you can see here. And I'm going to provide a few examples, not from each lesson, but just some of the types of things that are covered. Lesson 1, you already saw earlier on when Angela was discussing terminology. We have an entire about 2-hour module on terminology. Really goes into depth about understanding the concepts of sexual orientation, gender identity, and gender expression, how they are distinct from each other, what those words actually mean, as well as also discussing the coming out process for youth who are starting to be aware of their sexual orientation or gender identity, and how they may or may not express that to those in their community, families, and in the system. I'll talk a little bit about some of our examples from our bias training, and I'll provide a couple of communication practice tips. What I won't go into here is that in the actual lesson itself, that's the lesson, one of the lessons that does discuss a little bit more some of those pieces around data collection and specifically PREA, because there are some language around how staff communicate with LGBT youth within those PREA juvenile facility standards as well. Lesson 4, you also heard a little bit about that when Angela was talking about data. That's really about some of those risk factors that, or some of the reasons that LGBT youth may be more likely to enter the juvenile justice system: family rejection, homelessness, school climate, and bullying. And then we also address, ways to prevent those, and how we can promote kind of the positive factors for youth that would keep them out of the system. Lesson 5 is really a conditions of confinement lesson. It's really specific to the experiences within locked facilities, and it includes a little bit more about PREA as well. And then finally, lesson 6 is a lesson specifically dedicated to transgender youth. Although transgender youth are discussed in every one of the other lessons, it's often where there are a lot of questions are specifically around transgender youth, and especially around conditions of confinement type issues, so it goes into a little bit more depth there as well. Next slide, please. Right, so as I said, these are just a couple examples of the types of things that are covered in the curriculum. Next slide, please. So in our lesson 2, our bias training, one of the key areas of focus is on intersectionality, which I'm not sure if that's a word that everyone has heard of, but it's really just the study of the intersection of different forms of different discrimination or oppression. And why is understanding intersectionality important? It's because for youth in the juvenile justice system who identify as LGBT, it's not just about being LGBT. As we heard with some of the data, these are primarily also youth of color, but they also may be coming from different religious backgrounds. They may be youth with disabilities. They come from different parts of the country. They may have immigrant status, different socioeconomic backgrounds. And so we can't just, any of us can't just pull apart the various pieces of our identities. We are all of these things. And to understand the lived experience of young people who embody multiple oppressed identities, it's really critical for professionals who are charged with assessing and guiding people in the system to understand that experience. Even though we may examine different types of prejudice independently, youth don't experience them independently. So this lesson, we do primarily talk about bias specifically based on sexual orientation, gender, and expression, because there are tons of other trainings out there about other types of bias, but we really, really need to continue to raise this issue of intersectionality. And so these on the slide are just a couple of examples of what that looks like, which you can all read on your own and take a look when the training is back up online. Next slide, please. So this is also a part of the bias lesson, and just in addition to looking at intersectionality, we have some exercises that encourage participants to take a look at their own internal biases and implicit bias, but also to consider their agency or the system that they work in, and identify where on this scale that they consider the whole agency or their department within the agency, because it's important to do that self-reflection either as an individual or as an agency in order to move forward. Next slide, please. And then finally, another piece of the bias lesson is just really about brainstorming with participants about practical ways to intervene when either they see SOGI-based bias from staff or from other youth. And so, and this is adapted. I don't know why the source went away, at least on my screen it did, but this is adapted from GLSEN. Next slide, please. So as I mentioned, our communication lesson, I really can only talk briefly about it. It does cover much more about juvenile facility standards, especially I think, Angela shared what the standards require, but how, how participants may or may not be comfortable with that, and to get comfortable and sort of do some education around terminology and language, and to create safe spaces as well. So just a couple of the examples of practice tips are to make no assumptions, to send signals to youth that we're not making judgments about who they are, and assuming nothing requires us to very consciously choose our words. A very simple example is rather than asking a young person if they have a boyfriend or do you have a girlfriend, it's just to say, are you dating anyone? So that, because that implied assumption would be, depending on who you're talking to, of course, but that there's that implied assumption that they are heterosexual by asking, girl if she has a boyfriend. Using chosen names and pronouns is really important, and the best way to do this is really just to use whatever names and pronouns that youth ask. So rather than guessing, just ask them what they're comfortable with. And similarly, communication, our body language and physical contact is part of that as well, so nonverbal communication. Environmental signals can also be a way to create a safe space where youth are open or feel like communicating. So whether that's safe space stickers or rainbow flags, having LGBT inclusive materials in a waiting room or a library, there are a number of different examples. And then just on culture-specific language, there are going to be different variations in the ways that youth communicate, whether it's because of ethnic differences, geographic differences, socioeconomic, and there are also generational differences. So we always just have to be aware that language is constantly evolving. Next slide, please. We talked, I think Angela mentioned isolation a little bit, and I just want to share, this is just one piece, but it's one of the larger pieces of the Lesson 5, Ensuring Safety and Equity in Secure Settings, and it really talks about the experiences that LGBT youth have in those facilities. So youth are sometimes put in isolation for their protection, which really just punishes their identity. There's a ton of research around how harmful solitary confinement is, especially for youth, and then it may keep them out of programming, education, lead to increased suicide risk and mental health issues. Lesson 5 goes into isolation, but also a number of other experiences that youth have when they are in locked facilities. Next slide, please. So this video, I guess it was hard to show videos on the webinar, and it's like 12 minutes long, but I just wanted to share it because it's a video that we use in our transgender lesson. It's about 12 minutes long, And if you have questions and you just want a really basic, where do I start? I want to know something about transgender youth and transgender youth in the juvenile justice system in particular. Dr. Johanna Olson, who's a pediatrician in Los Angeles, at Los Angeles Children's Hospital, I believe, did this interview for us, and I think it's just a really good way to start learning if you're looking for that. I was worried we had so little time that I've been talking really, really fast, so I'm hoping that if Angela has anything to add that she will, but also just to encourage people that, you know, these PowerPoint slides are not what is in the curriculum, but I just wanted to give a brief overview and encourage people to really go to the website, look at the training curriculum. If you're considering facilitating the training, I really encourage you to read the trainer's guide, which has a lot of information about anticipated questions, how to use the training, how to adapt the training, and definitely to reach out for any additional assistance. And since we have a little time, I'm hoping if Angela wants to add anything, or that we'll just have plenty of time for questions as well. Thank you so much.
I don't have anything to add. If we want to just move straight to questions, that would be great.
Okay, so we'll be taking questions from participants at this time. Questions may be asked in two ways. First, you can type in your question into the questions box at any time throughout the presentation. Secondly, during the question and answers here, you can click the raise your hand button. I will then call on you, unmute you, and you may ask your question verbally. I ask that if you're on a cell phone, that you use the questions box, as that will avoid any audio feedback. We'll take a few moments here for questions to be entered. And as you think about your questions, I just wanted to remind everybody that the webinar is being recorded, and the recorded webinar, PowerPoint, and additional resources will be posted on our website within 24 hours. So we'll take a few moments for folks to enter their questions. So we've got a question for Angela here. You said 20% of the youth in juvenile detention are LGBT, compared to 5 to 7% in the general population. What did you mean by general population, and what types of facilities were included in this?
So that's a great question. The 5 to 7% is a percentage that is reported by the Williams Institute at UCLA, and that I believe that that's based in other surveys of teenagers, like other national surveys of teenagers that include SOGI questions. So there are a couple of different ones, like the YRBS. And so those national data sets suggest that 5 to 7% of youth between the ages of 13 and 21 are LGBT. And then, but for our survey purposes, we actually conducted 2 different surveys in the last couple of years. And the first survey was done in 7 different detention halls around the country, and those include Orleans Parish, Jefferson Parish, which are both in Louisiana, Cook County, Maricopa County, Santa Clara County, in California, Alameda County in California, and I know I'm missing 1, 2, 3, 4, 5, 6. I'm missing one. So there's oh, I know, Birmingham, Alabama, Jefferson County, and then the second survey was done. We just recently finished that a couple of weeks ago, and that was a survey of every single detention hall, ranch, and camp in California. So every secure facility minus the facilities run by the Department of Juvenile Justice.
Okay, the next question is related to data collection. When collecting data and asking young people questions about their sexual orientation, how do you take into account youth who may be fearful of talking about their sexual orientation and or deny that they're LGBT, or fear retaliation or condemnation?
So that's a great question. So what we know is that this is, secure facilities or, even informal intake is not the best time to start talking to youth about their sexual orientation and gender identity expression. And at the same time, it's not a bad place to start in terms of normalizing that the system is interested in all aspects of identity, and so and sort of acknowledging that sexual orientation and gender identity and expression can help shape what services young people receive while they're in while they're in facilities, but also what services they're referred to while they're on probation under community supervision. And so when we conduct our training, we provide really sort of concrete strategies and methods for making young people feel comfortable to really emphasize that we cannot see sexual orientation or gender identity, and we can only, interpret gender expression. And so it's really important to ask everybody. There's actually this really great example of a nurse in rural Louisiana, north of Calcasieu, who we were working with, who, and it's so often, the places that don't match, everybody sort of expects people in San Francisco to be good about asking these questions, but even this nurse in rural Louisiana, felt like it was really important for her to start keeping an informal tab on who the LGBT kids were in the facility. And so she used that strategy of just going up and saying, look, it's really important for me to understand everything that's going on for you. I can't tell what your sexual orientation is. I can't tell what your gender identity is. So I ask everybody these questions. And then, she wove them into all of her intake questions and got a really incredibly high disclosure rate. And so what we've found is that kids that are ready to share that information, share it. Kids that want to hold it closer to their vest do. It's so, setting a comfortable environment and then asking the question multiple times. So not just at intake, but as young people transition from caseload to caseload or from caseload to a community service organization, we really recommend that adults get in the habit of asking SOGI questions woven into all their other intake questions, because young people are more likely to disclose the second or third time, or once they realize that the system is genuinely interested in understanding.
And I'd just like to thanks so much, Angela. I completely agree with everything Angela says, and I think, and we do talk about this some more in our communication lesson, and it is so much about normalizing those questions and creating a space where sexual orientation, gender identity are just talked about. And I love the example of that nurse. We also aren't telling anyone if a kid is not ready to disclose that information. It's not about forcing someone to come out when they're not ready or they maybe don't feel safe, and recognizing those things. And a lot of it is just kind of about creating the space where either whether it's that kid or another kid, they do feel open. And the other piece about that is confidentiality. And depending on the purposes of the data collection, if it's, for instance, if it's to look at the disparities, sharing that with the youth, the why you're asking the questions, and also keeping things confidential when possible. Sometimes you may have, if it's required by law, but to be open with the youth about who that information is going to be shared with, if anyone, why, and when and how. I think that we often don't allow youth to participate as much as they could or we should, to kind of direct that conversation. And they may, even if they don't share that information with you at that time, it will help build trust so that they feel safe in the future doing that.
Okay, our next question is, do you have any recommendations for staff working in systems that are resistant to modifying policies or procedures and or provide training in this area?
That is a great question. Again, all these, what we have found, and so these are my thoughts on that. we have entered into jurisdictions at different times over the last 4 to 5 years. And my own personal experience is that systems were more nervous, 4 to 5 years ago before PREA trainings happened. And so what we found is that our work around policy and data collection has actually really dovetailed beautifully with Prison Rape Elimination Act standard trainings that jurisdictions are starting to do. And so a lot of times so that's just one thing. I think that what we found as a strategy is to really emphasize that somebody's personal beliefs are different than their professional obligations. And so our trainings and our policies really emphasize that, apart from however you may feel personally, and this is a message that a lot of system leaders have, it is your professional obligation to serve these kids in these ways. We now know what the best practices are, and these are the best ways. And so where jurisdictions pass a policy and then have the training accompany the policy has been a really effective strategy. And then going back to what I was saying about PREA, what we've found is that in jurisdictions that have already gone through PREA training, where they also understand that federally jurisdictions are required to collect data and also consider the needs of LGBT youth within systems, those three things dovetail really beautifully, and we've gotten buy-in from line staff at a much higher rate than we anticipated. And I mean, I can't say enough how successful our trainings have been and how supportive line staff from, first year intake staff up to seasoned chiefs have just been incredibly supportive of this work. So, I'm happy to talk about, if anybody wants to call me and talk about specific jurisdictions we work with, or if they want to be connected to jurisdictions that have done this work, I'm happy to connect anybody.
And just to that end, I would say the same thing as Angela, and I think it's so important to have strong leadership in order to get everyone on board and to really have the leaders be at the trainings, to be part of the trainings, to be pushing for those trainings as well. And it's also why training and policy really go hand in hand, is because sometimes it's just that the staff may not have had the training and really not understand the harm that then kind of violates their professional obligations. If these practices and policies that are in place are actually doing harm to LGBT youth, that's a violation of those professional obligations. And so to just impose a policy without really making sure staff are educated, and then also to do the training without having a policy that's actually, and I think I'll just go back to having enforcement around policies as well and how important that is. And so as much as, ideally we could all sort of get on board in this professional versus personal obligations, and everyone would just be like not want to do any harm, but there's also been litigation too. And if it comes to that, I would encourage people to look at jurisdictions like Hawaii. There was a case, RG versus Kohler, where when best practice standards are not being followed, there is also a threat of litigation too.
Okay, our next question is a two-part question. Does the training you talked about have a cost, and does it have to be done by somebody certified in the training?
Go ahead,
so
Christina.
The training curriculum that I discussed, no. So we have recently, it was released publicly. It's available on the website for anyone to do. And the reason was that it was just there, as you can see by the number of people that signed up for this webinar, the training requests that we all get to do this around the country, is that there's really a need and there's a capacity and resource issue for everyone to get comprehensive training. And so it's why we really worked for the last few years with our advisory committee, with experts in the field, to develop something really comprehensive. Now, so you don't have to be certified. We don't expect just anyone to pick it up and be comfortable doing it, but we do encourage you to really read the trainer's guide because it talks about who should do the training, how to organize it. You can certainly reach out to us for additional questions, technical assistance. We can try to recommend trainers around the country. If you're looking for someone to do the training, we have very limited capacity and resources. There are people around the country, not a lot, but there are people who will do this, but primarily for a fee, as well as any travel associated costs. But it's available, and so with a little coaching, I think there are a lot of people out there who, if you have a lot of training experience, if you have a lot of experience with the juvenile justice system, and if you go through a training and have understanding of the issues facing LGBT youth in the system, or if you partner, with a local LGBT advocacy organization that maybe doesn't know as much. I've seen some great partnerships that way where the local LGBT advocacy organization really wanted to work with the juvenile justice system, but they didn't know anything about juvenile justice, so we had to really educate them. And then the Juvenile Justice Association didn't really know much about LGBT youth, so it was a really great partnership when we couldn't be on the ground doing all the training. So definitely it's available on our website, and feel free to reach out for questions. There are other trainings out there as well, and I think Angela can probably talk a little bit more about their coaching methods. We, for the last few years, provided intensive technical assistance in a few sites around the country, but we don't have the capacity and resources to do that right now.
Okay, our next question is regarding data collection. Do you find that most youth understand the questions or need some explanations?
So we find that youth understand the questions, and so we at this point have collected data from about 45 counties in California, about 13 different counties across the country. On our surveys, we asked very similar questions, and we train research liaisons to actually be in the room where the surveys are being collected and when the data is being collected, and then we have these 12 counties that are collecting SOGI data. And I feel no one's ever called me to, raise concerns about youth understanding. I've looked at all the surveys, a handful of times kids will make jokes on an anonymous survey, but we have intentionally designed the questions for a 5th grade reading level, understanding that many young people have learning disabilities. We also have, as I mentioned in the PowerPoint, we have a separate set of questions for slightly younger kids, and if anybody's interested in that, please reach out to me, and I'm happy to share a copy of that with you.
Okay, our next question is regarding the overrepresentation of LGBT youth in terms of prostitution and status offense arrests. Is there any data on what percentage of juvenile prostitution arrests are actually LGBT GNC youth? Is there any research on how gender stereotyping results in some of this overrepresentation?
That is a beautiful, beautiful question. The research on LGBT youth is very, very young. So these national surveys that we've done are the first system research that's been done on LGBTQ and GNCT youth, and so we haven't partnered with prosecutors or public defenders yet to be able to understand those processes. But if anybody's interested in partnering with me on that type of research, I'd be glad to try to find some funding, or to hook you with some other researchers that are interested in this topic. But it's as with racial and ethnic disparities, we need to understand what happens at every point in the system, and so whatever I can do to help you all understand that, I'm happy to help.
Okay, our next question is, do LGBT organizations outside of juvenile justice facilities have a role to play in supporting youth in corrections? If so, how can juvenile justice facilities and LGBT organizations create partnerships
that fit in with policy standards?
So thank you for that question. You know, in the vein of all of our efforts to de-incarcerate youth, you know, I think the field in general is really working to develop continuum of services within communities. We just completed a research project on youth programming in the 5 jurisdictions, or in 5 of the 7 jurisdictions we collected surveys in. And what we found is that most youth services fall into 2 camps: LGBT youth centers and centers that serve youth in the juvenile justice system. Very rarely do you find an organization that crosses both organizations. There are some, you know, a handful of examples of centers that do both. RISE in Richmond, California, Breakout and youth empowerment programs in Louisiana. But in general, what we find is that LGBT youth centers are not culturally competent to serve juvenile justice youth, and the juvenile justice centers are not trained up to serve LGBT youth. And so, so there are a couple of different things. I think that with regard to serving LGBT youth, what we really recommend is that systems bring in training for their own staff to also partner with community-based organizations that they already have relationships with, and to ask those organizations to train up and become culturally affirming for LGBT youth, because even if young people disclose at intake what their sexual orientation or gender identity or expression might be, they may not want to be out in the community. And so it's really important that all services be able to serve young people within their facilities. And then in terms of partnering and building capacity, I mean, certainly if you have an LGBT center that does want to train up and become culturally competent to serve juvenile justice kids, that's a bigger step. That's a bigger reach, we find, for LGBT centers. But you would follow the same sort of procedures that you do with new community-based organizations in your community in terms of, you know, developing small contracts, piloting projects, and then, you know, documenting what works and what doesn't work, and sort of go through a process of continual program improvement.
And just to go a little bit more broadly than that, I agree with everything Angela said about the community-based organizations, and we've had some great partnerships there. But local and also national LGBT advocacy organizations, I think when we look at just the numbers of this community and how they're being impacted, youth and adults, and the criminalization of identity of being LGBT. When we look at how 40% of homeless youth identify as LGBT, and you know, youth often being arrested for you know, for trafficking because they have condoms and using that as evidence, or quality of life type policing. I think that definitely the national LGBT advocacy organizations, probably some of the local ones, also definitely have a role and responsibility to kind of raise the issue about the overrepresentation, that these are kids that shouldn't have ended up in the system in the first place, and so to help address those disparities as well.
Okay, unfortunately we've run out of time. There were lots of great questions, so if you'd like to follow up with the presenters, please feel free to reach them at the listed contact information there on the slide. I'd like to thank our presenters today, and if you require a certificate of completion for this webinar or would like to hear more about future webinars, please feel free to contact me at the email listed there. That concludes today's webinar. Thank you for joining us. And we look forward to you joining us again for future CJJ webinars.
Thanks, everyone.
Thank you.